The mortality rates above 25, but mainly regional referral hospitals.
Today is day 3 of the 4th annual Safe Motherhood conference, and we are here to participate in this conference. 3 of our staff are going to be participating by presenting their abstracts on different programs that we have been doing, and also one of our trained mentor midwife is among the award winners that are going to be recognized nationally for the great work that they have been doing. That is Sister Janet, who is a trained NICU nurse that has been trained by BAMA. So we are very proud that BAMA Foundation is being recognized for their work that they are doing, that we are doing in southern central of Uganda.
We've been able to look at the maternal and child healthy national picture, but what I've learned from this is that our region we're implementing, that's a greater massacre, mothers that are dying, actually dying of a preventable cause, that we have actually put our interventions in, that's postpartum hemorrhage. So that basically indicates the need for us as we expand to tackle the deeper issues within this space and address the key issues that have been presented in the national MPJSR reports concerning postpartum hemorrhage killing mothers in the region where
reduction of maternal mortality by 6 points.
There are some things which are cryptic that you should.
And then you can refer to that.
And what has been my take home today, like the theme of this Safe Motherhood conference has been strengthening community engagement. The fact that BAMA has very many community interventions, I've been happy to know that there are other people in Uganda that are willing and ready to work with the community and engage other community stakeholders. And as a midwife, I like that we are engaging more to save the mothers of this country. Thank you.
My biggest takeaways are really the shared importance and awareness and commitment among the nation, among Uganda, among all the different districts and departments and implementing partners and ministries, that things need to improve and where we want to go. The second takeaway is the importance of community engagement, which thankfully BAMA is already doing, with the Mama and Papa ambassadors, for example. And last but not least, that also leads me to my third takeaway, is that there have been people on stage talking about stuff like hospital to home or Mama and Papa ambassadors, and I'm like, wait a second, that's exactly what we're doing. So not only is BAMA already implementing quite a few things, but also my takeaway is how can we make sure that next year we are on stage and we are being mentioned, and also how can we make sure that we bring even more stakeholders together for even wider impact.
No participation, you have all talked about history of health. Thank you.
Highlighting the impact of mobilizing communities.
Will this take long? But also since
of course, I'm excited that there are very many partners that are taking this seriously, and the take home is every key stakeholder appreciates that family planning is critical in our development process. And it's not a medical issue, but it is something that is more of social, and it is cross-cutting, and everyone is taking it up as a cross-cutting issue. On part of the institution, luckily, the cultural leaders are also appreciative that family planning is key to development, and we have committed to demystify those negative cultural beliefs that affect uptake of family planning. We intend to mobilize through every opportunity and platforms to engage our communities to appreciate and uptake family planning as one of the strategies to develop our kingdom. So we commit to work closely with the partners, as has always been the cause, to improve access and probably to ensure that health access is not only accessible, but it is affordable and available. I thank you very much.
It's meaningful conversations
around strengthening community engagement to improving maternal and neonatal health. It's amazing to see issues, coming around on, having community engagements, looking at the cultural leaders, the religious leaders, the healthcare providers, the government, the ministries, to see that really the quality of care that our mothers receive is really, it has respect and dignity. And as a soft skills trainer, there are usually very many things that have been popping up in the discussions, issues around attitude, issues around communication. And as a trainer that I have a wealth experience in doing this capacity building training for healthcare providers, we feel that now this is the right time for us to be able to integrate soft skills training into maternal and child health, hence strengthening respectful maternity care. Issues around communication, attitude can be able to be addressed, leadership, motivation, critical thinking and problem solving. And we are very much willing and ready. This project will be pioneered and launched. We want to collaborate with every healthcare facility in this country to go and strengthen ourselves, build capacity, so that we are more aware of what we are doing and we can be able to achieve the respectful maternity care. Thank you.